Are you doing scar massage after your lumpectomy or mastectomy surgery? It's often overlooked as a recovery tool, but it can provide some real benefit in more ways than you think. This video will explain why and show you the exact steps to follow. Hi, I'm Erica. I'm a breast cancer thriver and a chiropractor. What exactly is scar tissue? Scar tissue is the body's normal response to any sort of trauma or damage to the soft tissues. The problem is that scar tissue isn't elastic like our other tissues. It can bind down and almost adhere to some of the surrounding tissues and restrict movement, and so this will lead to pain and tension in those areas. There's scar tissue that you see externally, which is the incision site, but there's also internal scarring that you can't see, and this is just as important to address. The benefits of scar massage apply whether you've had a lumpectomy or a mastectomy. And if you've had a mastectomy, this is also helpful whether you've had flat closure or reconstruction. Scar massage doesn't necessarily break up the scar tissue like you hear some people say, but it does do a few very important things. It helps improve the movement of fluid in the area. For example, moving the lymph fluid will help to reduce symptoms of lymphedema, and moving the blood will help to improve healing. Also helps to allow that scar to slide and glide on the tissues that it might be adhered to below. Helps incisions heal smoother and flatter. Decrease pain in the scar area and some of the surrounding areas. Improve shoulder range of motion and function. Everything in the body is connected, so when you release one area, such as your breast scar, it can have an effect on releasing some of the other areas surrounding it, like your shoulder. Helps reduce cording. Scar massage isn't often recommended when it comes to managing cording, and I'm not sure why, because it's really helpful. Lastly, scar desensitization. Scars can sometimes feel sensitive, tight, or even itchy. Doing scar massage in these areas will help to improve these symptoms. When can you start scar massage? In general, after your incisions are fully healed, which means completely closed. You can check with your surgeon on when it's right for you to begin. I started at around 6 to 8 weeks after my double mastectomy. For my exchange surgery, I waited a bit longer on the radiated side as that took much longer to heal. If you're watching this and you had your surgery many months ago or even years ago, it's never too late to start. You can still see the benefits of scar massage. It'll just take longer for the changes to occur. There's one caution for scar massage in that you want to avoid it during radiation, as your skin will be quite irritated at that stage. How often and how long should you be doing scar massage? You can do this daily for a number of months after your surgery. You could set a timer for 3 to 5 minutes a day and work through the steps that I'm going to show you coming up. I started doing this daily for many weeks and then spread it out to every other day after that. What cream should you use? You can use some sort of oil, cream, or nothing at all. For oil, I tended to use bio oil just because I already had it. You could also use coconut oil. And for cream, you can use any sort of clean cream that you already have at home. I would test this out, try oil one day, cream another day, and then nothing at all, and see what works best for you. How deep should you apply the pressure? You do want a firm pressure, but something that's tolerable. If you have pressure that is much lighter, it will take longer for the benefits of scar tissue massage to kick in. With each step that I show, you can start out with lighter pressure for the superficial layers and then go a little bit deeper as you go. If you have hypersensitivity of your scar, and so this just means that some areas along the scar are going to be more sensitive than others, then this is an indication that you need to be doing more scar massage in that area, not less. What are the scar locations? For a lumpectomy, you'll do your breast scar, but also the separate incision in your armpit area where lymph nodes were removed. For a mastectomy, you'll do along the breast scar, which may be right across the center of your chest or under the breast fold. You may not have that separate incision in your armpit area where the lymph nodes were removed, as they're often removed through that central breast scar. But like I said before, you'll certainly have that internal scarring, which will be helpful to address. I ended up doing a lot more scar massage right in the center of my mastectomy scar. I had tissue expanders, and the port of the expander was right underneath that scar area, so I could just tell things were sort of really bound down and tight in that area. For autologous reconstruction, like a DEEP, you'll want to do your entire breast scar and your abdominal scar. And because this is a much larger area, you may want to do a couple more minutes a day on this. If you had lat flap reconstruction, it will be challenging to be able to reach that scar on your back, so you can focus on doing your breast area or have someone help to release that scar on your back. You're going to use either 2 fingers or your thumb to do the massage. You can switch up the hand that you use, so you can either use the same side hand or the opposite side hand. If you're using your thumb, I find that doing it on the same side is easier, but kind of awkward if you're doing it on the other side. Your fingers or thumb may get a bit sore doing this, so that's why it's helpful to switch things up. You can put a small amount of cream on the tips of your 2 fingers or on your thumb, or again, nothing at all, and then you're going to work your way through 4 steps. I'm going to show through my shirt for my breast scar, but then use my arm as an example to show on actual skin. There's a really important tip for where to start and end the scar massage, so I'm going to cover that once I go through the 4 steps. The first step is to go along your scar in an up and down pattern. Some people call this a zigzag pattern. You're going to be moving perpendicular to the scar the whole time. You can start at one end of the scar and do that up-down pattern a few times and then move your way along the scar, repeating the same thing as you go. The next step is a circular pattern. You can do a few small circles at one end of the scar and then repeat as you make your way down the scar. Some people will do an up and down or zigzag pattern going in one direction of the scar, and then when they get to the end, they'll do that circular pattern going back in the other direction. A side-to-side or longitudinal pattern is next. You're going to start at one end of the scar and move your fingers on top of the scar, moving back and forth a few times. Then you can pick up your fingers and do the same thing, moving along the length of the scar. The last step is tensioning, and this is definitely the most aggressive of all the steps. You're going to grab the scar in between your thumb and index finger and squeeze with tension like you're frictioning 2 surfaces. You're also going to be slightly pulling up on the skin as you're doing this. You'll see more benefit if you're not just squeezing the tissues between your thumb and index finger, but that you're actually tensioning those tissues. Tensioning will help to release that scar tissue from the areas below that it may be adhered to. You'll definitely feel this one more than the other steps, but if you do have some areas of your scar that are thicker or just more sensitive, you will see some good benefit from this one. I would add this in once you've done the other steps a number of times, so maybe doing it about 2 weeks after you start your scar massage. The next step is addressing the scar tissue in your underarm area where your lymph nodes were removed. How do you know where to massage in your underarm area? If you've had a lumpectomy, that's easy because you'll actually see that separate incision. With a mastectomy, there's that internal scarring that needs to be released. For me, I could literally feel a bump in my armpit area for quite a few months after my mastectomy surgery. This is where mine was, and you can check to see for yourself if you can feel anything there. It helps to check the other underarm area, which you obviously would not have a bump there. But even if you can't find a bump in the affected side, you can still massage around that general area and see some benefit. What type of massage is best for this area? I find the circular pattern works really well. Just like the breast massage, you can switch between using your 2 fingers, usually on the opposite side hand, or your thumb on the same side. I would do a few areas right around where I felt that bump, or in the general area. If you found value in this video so far, a subscribe would mean a lot to me. It really allows me to reach more women going through this breast cancer experience. Cording usually extends from the armpit area down the arm, but if you trace that back up to the armpit area, there's usually some cording that extends into the breast as well. After my double mastectomy, I definitely had cording, And when I traced it back from that armpit area, it went into the side of my breast and also linked up with the outside of where my mastectomy scar started. Because everything in the body is connected, if you're releasing some tension in the scar area after surgery, it can also help to release the tension that's feeding into the cording. An important tip for all of the steps for scar massage. You want to start your scar massage not just right where the scar visibly starts, but about an inch before that. So if my mastectomy scar is here, I would want to start my scar massage here and then go all the way through and then finish up ending an inch on the other side. So remember, there's that internal scarring that's underneath that incision site, and you want to make sure that you're addressing all of that tension that's there, which usually extends past that incision.